Welcome back to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company in Pittman, New Jersey with my good friend, Dr. Frey. Dr. Frey, how you doing?
Spectacular.
And we have our former guest, Dr. Brandt, back on the show from, been over a year, Dr. Brandt.
It's been a while.
It's been a while.
Holy crud.
Right? And
Over a year?
Over a year.
Yeah.
May of 2024.
I think at that point you probably were on the show more than anybody else. I don't know if you still hold that title, but you might.
You
It's
might.
the good
I know,
news.
there was a good stretch for
yeah,
a while.
Yeah.
So,
What a good time to have you back, though.
I know. We kind of stacked up the list a little bit, and it kind of just, as nature would have it, we got a couple good things to talk about tonight. But before we go ahead and dive into tonight's show, we want to give a quick shout out to our sponsors, Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walkers, hip to yard work, back and laptop wrist. They have a doc for that. So find the right specialist for you at virtua.org/ortho. So, gentlemen, how are we doing tonight? Dr. Frey, how you doing? You just got back from a trip?
I did, yeah. So we've kind of found this little niche, my kids and I, where right around Rosh Hashanah every year we end up going doing a backpacking trip, and rather than spend the day in a temple, in a synagogue, and like we figure like grandeur of nature, be out there doing stuff, we're together and just kind of enjoy it.
Right.
So that's what we did. Last year we did Dolly Sods backpacking trip around Dolly Sods in West Virginia, which was unbelievable. And I don't think it's super well known. And it's a park in I think I forget Monongahela National Forest or whatever it is, and spectacular. This year we did a little combo trip, sort of camping, sort of backpacking, up to upstate New York. There's the Finger Lakes Trail, which again, it's unbelievable to me, but I don't think many people know about it. It's an extension of what I think is like the Northern Trail, which starts in North Dakota, goes across the country, dips down into Pennsylvania, up the Grand Canyon of Pennsylvania, up into New York, and then from there goes up across the Finger Lakes region, like right below the Finger Lakes, right across through Ithaca, and then all the way out to, I think it goes through the Catskills. I don't remember for sure, but out into Albany. And essentially that's where it ends.
So is that Catskills or Adirondacks?
I think actually Catskills to Albany. I don't think it goes to the Adirondacks,
Okay.
but I'm not 100% sure. But the part we did was right around near Ithaca, the Finger Lakes Trail, and then. So three of the parks up there: Robert Treman State Park, Buttermilk State Park, and Watkins Glen. I mean, just unbelievable. If you've never been, if you've never seen it,
Been to Watkins Glen before.
right.
Yeah.
So you understand like
Yeah.
the gorges and the
yeah.
like it is, and like the gorge trails are utterly spectacular. And so you can actually. So we actually went in. We camped first. We got to Robert Treman, did the gorge trail there, blown away. We camped there that night. Then we backpacked. So we packed up. I left the car there. I kept the campsite an extra night. We packed up our stuff. We backpacked. We hiked to Buttermilk State Park. That was on the Finger Lakes Trail. That's like probably like 7 or 8 mile hike. It's not super far, but not nothing either. And we get there, and like we were cooked. And to get once you get there, to get up to the campground, you got to go up this massive hill. And I will say, I think the people that were working the desk when we checked in took pity on us. It was so nice. And I'm like, we want to get firewood. I'm like, do I got to carry that up? So the one lady is like, just get in my back, like the back of the pickup truck. I'm just gonna drive you guys up. And she did. She drove us to our campsite.
That's awesome.
And so then we stayed over at Buttermilk, and then you can go from Treman. You can hike to Watkins Glen, which is west of Robert Treman.
Okay.
And that was the original plan, but we kind of, we didn't know if we were going to have enough time to do it all. So we ended up just driving from Buttermilk to Watkins Glen, and then we hiked Watkins Glen. And also just amazing. Like all three, like a little bit different. They all look, they're not exactly the same. And it's just, if you haven't gone to see any of these, they are stunning. So yeah,
It's
great
really nice
trip.
up there. The Catskills, there's a lot of like wilderness and woods up in the Catskills. It's a big area of mountains, and it's like in the Adirondacks. Like there's so much more land up there than you think about it.
So we were going to do Adirondacks, which is not far from Lake Placid.
Yeah.
We were just talking about that.
Right.
And there's I think it's like 10 peaks or something. Like that's a tough hike. We were going to do that. We were going to have to cut it off because there's no way we were going to have enough time to get it all in. But so we were debating between like true backpacking, which is what we did at Dolly Sods. We're like, you're out there. It's not a campground. You don't have a car. Like you go and then you get back 3-4 days later and you just got to make do. Versus what we did on this, we're just like, backpacking, but then I had a car for like 2 of the night. You know what I mean? Like it's sort of an in between. I think next year we're gonna probably go to the Adirondacks and do that cutoff.
Yeah, the Adirondacks are a lot bigger mountains than I would have expected. I had never been to the Adirondacks. I've been to the Catskills a bunch. We were in the Catskills this summer.
Right.
You know, but the Adirondacks are a lot bigger. You know, cliff sides and mountains.
Some scary stuff, man.
It almost feels like you're out west in some of those areas. It's big.
I know. It's awesome too. And I can't explain it if you haven't done it. Like you're just in nature. Your whole thought mode is just like, all right, where are we going to stop? Where are we going to set up shelter? What are we going to eat? Like it's very, very like sort of basic, sort of like. And like all the noise, all the other stuff, like I feel like almost out of touch a little bit just from football this weekend because I didn't pay attention to it at all, right? Like all that stuff goes away. That insignificant stuff goes away while you're out there. And it's just, I don't know, it's fun. It's just nice to be out there and be in the moment.
Recenter, reconnect with life a little bit.
There really is. And then like my kids love it and they eat it up and like we interact and we talk about stuff. Like it's great. It's great. Yeah.
That's awesome. So good to catch up with all that. And then tonight we're going to talk about some injuries that had already started in the NFL, like week 1. And then as nature would have it, we kind of let it marinate for a couple weeks and we just built up our list here.
That's right. That's right.
But I think the big one in the NFL that's kind of taken, social media and the news reporting by storm for the most part was good old turf toe. We had Brock Purdy go down week 1 with it, and I believe Joe Burrow was week 2, if I'm not mistaken, with it. So it was like back-to-back weeks, pretty big names in the NFL starting quarterbacks go down with this injury. Brock Purdy was kind of like not underreported, but didn't seem as significant, but he was out with it. And we talked about him on the last show we did with the week 1 injury. He had the turf toe and they had the AC joint sprain, all on the left side, which is a good thing for him as being a right-handed quarterback. And then you go into the Joe Burrow case where it seemed more significant. There was surgery involved. So then we called Dr. Brandt and we're like, let's figure all this out because he's our guy.
Yeah. And I feel like, turf toe, you hear turf toe, you're like, what? What the heck? But it's actually a bad injury.
Yeah.
It's a tough one.
Yeah. And then from a surgical standpoint, it's pretty rare. It's pretty unusual. Usually this is one of those ones where like it just hampers a guy. It's a problem. He's on, he misses some time, he doesn't play well. But like it's unusual to hear surgery. So first, why does Brock Purdy not need surgery and Joe Burrow need surgery? What the first question?
There's a classification system for it. One is more of a sprain of the joint capsule, and the whole way to, you're rupturing ligaments, rupturing the capsule, and rupturing a tendon on the bottom as well.
What capsule? What joint is the problem here?
So it's the metatarsal phalangeal joint. So it's the base of the big toe. It's not. It's not so much in the toe, but it's like where the toe meets the metatarsal, where the toe meets the foot.
Right.
And the bottom part of that capsule is a big, thick ligament you call the plantar plate.
Right.
And you can sprain the plantar plate, and it's just that hampering, long-term, kind of lingering pain.
Yeah.
But if you rupture it, then it leads to dislocation, where your big toe is dislocating from the metatarsal. And that's where then you're grinding cartilage, then your joints slipping out of place, and it just causes that effusion. Your joint can swell, and it's just that constant pain.
But
if you rupture it,
I didn't mean to cut. Like when we see this, like it's always a big, huge swollen joint.
Mm-hmm. Right. But if you rupture it, especially if you rupture the tendon along with it, where I was saying it's kind of difficult to, describe the anatomy down in there because it's such a small little spot. Right. But you have your 2 little sesamoids below it. It's 2 little bones that kind of slide along the bottom of that joint that you're walking on. And they attach to a tendon from the back side of it and the front side to it. And then right beneath that is the capsule, the joint capsule, which is the plantar plate.
Okay.
And if you tear the plantar plate and then tear it and dislocate it high enough, you're going to tear that ligament beyond those little sesamoid bones as well. And when he had a grade 3, which means he had a rupture of one of those ligaments, and it's just, you can't treat that conservatively.
Right.
Huh.
Grade 2, grade 1, you can treat conservatively and stay in a boot for a while. And no matter what, it's a long recovery.
Right.
Yeah.
But especially when you go into operate on that spot, whereas that's where you're standing directly on that spot and planning and pushing off that spot, running on that spot, especially on his right side where he has to push off of.
Right.
It's going to be a long recovery.
The tendons from those little sesamoid bones are plugged into. Is it outside of the capsule? Or does it actually like almost become almost one with the capsule?
They are outside of the capsule. The capsule is right around the base of the toe and attaching to the head of the metatarsal. So the capsule is just right around the joint itself.
Yeah.
Right beneath that to the weight bearing surface is the the tendon that attaches to the sesamoids, and the sesamoids are kind of almost sitting within the tendon.
Right.
And it rarely, tears proximal to that, behind that. They tear right just distal to that, right towards the toe.
Between the sesamoid and where it attaches to the
toe.
Yeah.
And you hope that you hope for his sake it's the tendon tore and you can repair the tendon to tendon rather than the tendon tore off of the bone. So the tendon can tear off of the bone itself. Then you have to try to put anchors in,
right?
And anchor the tendon to the bone, which every time you take a step, you're dorsiflexing that toe, lifting the toe up, so it's weakening. But if you can go tendon to tendon, it can get a better attachment. Hold it there long enough, let it heal long enough, and then it's can be more supportive.
Right.
But I don't.
I got to
exactly
imagine you don't have
had.
a lot of real estate to work with in that area.
And it's such a tiny little spot. That's the tricky part. You know. You can also, I didn't hear that he had a sesamoid injury as well, but those sesamoid injuries can be brutal as well. So if there was a stress fracture, if it chipped a piece off of that, then that may have been a component to it. But sometimes, you would think for him, you would try to leave those sesamoids intact. But sometimes all you can do in that scenario is try to reapproximate that tendon and take out that sesamoid, which can lead to other complications in itself.
Right.
But you hope that it just tore beyond that sesamoid and they could put that tendon back together in that area and then have to repair the plantar plate, which is a whole other ordeal in itself.
Right.
And I don't know how they did that specifically. You can directly repair the plantar plate, put it back together, but if it tore off the head of the metatarsal proximal enough, you would have to put anchors in the base of the toe, anchor that down to the bottom. And I can't imagine him, a 3-month timeline that they gave him. That's going to be pushing it.
That's optimistic.
Yeah. I would not think unless they were deep into the playoff Super Bowl contender. And at that point, like, when do you put him back in?
Right.
When have you last? I guess it's Joe Burrow. You take Joe Burrow over
whomever.
Browning, the
Right.
backup. But still, it's like that's going to affect you.
Yeah.
I can't imagine him coming back. I think his year's done.
Yeah.
And just for clarification, for that, all those little caveats and variables for surgeries, typically for the treatment for a grade 3 turf toe injury like he has, right? So yes, there's a classification and he has a grade 3, so it's on the worst end, but then you have all those variables that, again, like we always say, we don't have access to his actual records and what he has to deal with.
Yeah.
So all that extra stuff is just not an added bonus, like an added, variable of things that can make this worse or better, in his case. And that's like something you want to see, and it's like, oh man, that's tough. Whereas you flip the script a little bit and you talk about Brock Purdy, kind of literally opposite. It's on his left foot. It's on his front foot when he's throwing.
It's easier.
Was not reported as a grade 3. There's no talks of surgery. He's currently a limited participant in practice, so it's like a little bit better off for him, but still a problem.
What is the treatment for that guy, for the guy who doesn't have this one and needs surgery?
Well, it all comes down to the imaging.
Yeah.
The MRI specifically, but he must have had more of just a sprain of the capsule. I would say the tendons are intact, the sesamoid complex is okay, so you can rest that, let that capsule scar in and get there. It's just like you sprain an ankle without rupturing ligaments.
Do you boot him? Is it okay to just let him walk? Or
oh no, you boot it. You immobilize it. You don't want to dorsiflex that. They're probably KT taping him down. He's working with trainers and everything, but you don't want to extend that to let that capsule heal in and scar in. And even at that point, those injuries can take a long time too, until you have to basically build scar tissue and then work out that scar tissue and rehab from that.
Right.
So he must have had on his imaging more of a sprain. He probably didn't tear anything.
Yeah.
Right.
And it's like in a grade 3 is the capsule, the plantar plate, and the tendon.
Yeah. So that's always been my impression of turf toe, is that injury, the Brock Purdy version of it, where you injure the plantar plate, you injure the capsule, there's a sprain, this and that. It's a nuisance. You think you're getting better, and then you re-injure it when you go back out and play again, and all that stuff. But I was very surprised when they were operating.
Yeah, and most of the time that's what you see. It's like I see those injuries, those maximal dorsiflexion sports injuries. Someone fell down on it, or someone rolled up on the back and maximally dorsiflex that joint and injure it. But most of the time, even if you get the MRIs, there's some injury to it, but there's no rupture to it. And it's like you go into a boot for a while. So the majority of them, are that grade 1, maybe a grade 2. But grade 3 means that he probably dislocated the joint,
right?
And then maybe it stayed dislocated or not, but there was trauma to the tendon, it ruptured.
And I think it's interesting too with the Joe Burrow injuries that, like, when you watch the video at first, there was a guy like just on his opposite leg, just twisting him down. And that's when he went down. I was like, oh, he definitely jacked up his knee or the other side. But then after watching the replay, it was just right foot got stuck, and then it just got stuck, hyperextended, and then it just last second just kind of went out, and then he was just like stuck there, and he didn't move, and then they took him out, and that was all she wrote for the most part. And that's like something you don't want to see, and it's like, yeah, you can only tape that thing so much to help put plates in their shoes and all that other things.
Carbon plates.
Yeah. Only going to go so far.
Yeah.
Because the problem is instability.
Right.
If you try to let that heal on its own, you've torn that capsule, so now the joint has more play in it and can move around more. So it's when he's trying to push off, run, it's going to allow the joint to slip out of place.
Right.
And it's going to be pain.
So
for him long term, it's definitely going to be, a lot of arthritis and
hallux rigidus.
Down the road, he's going to end up with a fusion of that joint or this or that.
Well, that was my next question for you. So from a surgical standpoint, it's not just putting a wire across the joint and let everything start to scar in around it for the time being, but it's actually repairing those structures.
Yeah, and I mean, obviously it depends on who you are. Joe Burrow, of course, you want to maintain that motion and maintain that flexibility, and you repair everything anatomically.
Yeah.
If you're older and you're not a pro football player, it's like sometimes it's like, look, if you're already arthritic in there, it's been a while that plantar plate, you've had that injury. It's like you can go in and you can fuse that joint, just immobilize that, lock it up, and you're good.
You do okay, yeah.
But someone like him, you're gonna have to. You want maximum performance from him, so he's going to end up, trying to anatomically repair it, and you can get back to it. I mean, I've had patients that have done well from it, but
Sometimes
not
so
at that level. And it's sometimes it's just like it's good, but there's always that lingering. You can also damage cartilage when you did it. They may have known on the MRI at that point, but sometimes it's like. I tell patients all the time, like cartilage is almost like if you take an apple and you drop it, that apple is perfectly good, all right, but there's a dent. Mm-hmm. But over the next couple of days, only the dent becomes soft and mushy.
That's a good analogy, man.
With cartilage, it's like, it could be, weeks, months, years, but that where that dent was, it looked perfect initially, but it's like that dent gets
Falls
soft,
apart.
mush, and it's like then you end up with just pain.
Yeah.
What do you do from there?
That's a good analogy. I'm actually going to adopt that. Thank you.
Yeah, I might take that one too. That's a pretty good one.
Is there anything that you would note on X-ray, even before they get an MRI, to indicate to you like, oh man, this might be going down this bad pathway?
Yeah, so for him, these guys are getting MRIs no matter what. They, injure something, they're getting an MRI. But, in the normal population, it's if you have an injury to that area, you're obviously going to start with an X-ray, an AP, medial oblique, lateral film. And if you look at that film and the two sesamoids, they're typically lined up right in the row with each other, right, just right under the metatarsal head. They have a little groove they sit in. Yeah. And if you look at it and one is a little bit distal or proximal to each other, as they're a little offset, you can, in that case, I would go and I would take a contralateral X-ray, take an X-ray of the other foot and see if that is, it may just be their anatomy. They're just a little bit, one's more distal than the other. Yeah. But if you look at that and the other side is the same, and then that's one side, the sesamoid is offset a little bit, then it's, okay, MRI, there's probably a ligament or a tendon rupture. Yeah. So then the MRI is going to tell you everything, but it's not as easy as for the general population to just get that MRI off the bat than what Joe Burrow is.
Right.
Yeah, Joe Burrow got that on Monday, whereas general population would take a little bit of time.
Ordeal.
Yeah.
Right. He's not young. He's not old, but he's not young. And if this is his push-off foot, let's say everything goes great with the surgery and whatnot, do you anticipate he gets back to being Joe Burrow, or does he maybe comes up a little bit short nowadays because of that?
I think he could. Joe Burrow's a pocket passer. He's not a running quarterback. He's not doing tush pushes. And, he's standing in the pocket and he's throwing. He's like a Brady quarterback. Yeah. So I think that he could. I don't think it's going to be this year, but I think that he could stand back there in the pocket and throw. And I'm really sure they'll modify his like a little carbon plate in his shoe, something like that, some sort of modification where he's not bending and flexing that much. I'm sure he's going to be when he comes back this year, next year, whatever. They're going to tape that thing down like crazy, so he's not bending it up and causing himself pain. Yeah.
So this is probably the last question I ask about this. So earlier in my career, I was doing more of everything. Now it's more just like shoulders and knees. But when I was doing a lot of foot and ankle stuff at the time as well, every now and again you would be seeing someone for whatever injury around their foot or around their ankle, and you get the X-rays, and you see like the sesamoid bone like in half and separated and whatnot, and they're like fine, and it's a non-issue. And that's hard to reconcile with what's going on. Is it just like lower level of energy, or sometimes the injury is worse and sometimes the injury is less. Or
Well, it can be a bipartite sesamoid, so you can
Yeah.
you can have that congenital like 2-part sesamoid.
but then
looks like
it's
it's
not
an old
separated,
fracture.
right? Like it just, yeah.
They're close together, but
Right.
it's like if you know someone comes in with an injury and there's a separation there, you know, you look at like kind of the edges of that sesamoid. If it's a rounded, you know, smooth surface, it's probably just they were born with that as bipartite. You can have 2 parts to it, and they're fine. But sometimes that can also lead to instability where you injure that and you almost separate that little area between those two, that bipartite sesamoid, and then that can be an issue. Then it's like, do you take that out? Do you take out one part, anchor the rest to it? But yeah, the bipartite sesamoid, you look at the edges. If it's sharp, jagged edges, it's a fracture, and they can be a nightmare. That could take forever. You take it out, whatever, and it's just like it takes so long. It takes so long to heal from. That's what I'm saying. I can't see him coming back from an injury to that joint complex.
Right.
Yeah, I had one football player one time, very large defensive lineman, like 380 plus pounds with sesamoiditis in his toes, and it was like one of the hardest things to get someone back from. It was like it took him.
Was it really?
It took forever because I mean, so much force is going through that joint.
And you think it's such a tiny little bone, but it's like you're standing. Everything you do involves that.
Right.
Every
bone.
step you take involves that little complex. You know.
And it's funny because we'll dismiss a lot of the smaller toes, like it's a toe, but like with this one, like you can't, like
the hallux, the big toe, it's like that's a big part of your function.
Right.
Yeah. The rest of them, whatever, tape it up, you're fine.
Figure it out. But
you know,
the big one.
but the big toe, it's a lot of balance. It's a lot. Yeah, it can hinder you for sure.
I think it's definitely, like you said, overlooked a lot. It's just a toe. It's like, no, that toe's pretty important for a lot of things, especially for him. Like, I don't know what the biomechanical advantage or whatever the case is, but like, who knows? It could affect his throwing ability too, like his ability to really push off of that foot and try to launch the ball deep down the field. And all
a lot
that
of
stuff.
force is generated from the ground up, you know.
Right.
So yeah.
So we'll kind of see what happens. But so what's our general prediction here? Do you think, I think most articles are saying he's about 3 months out, possible week 15 return. Do we think he's coming back?
When I do my drafts, I generally kind of like tier my quarterbacks, and like if my pick is coming up and a lot of the guys from that tier are gone, then I'm like, all right, time to dive in and get a quarterback because like now I'm getting a value because I'm getting like a guy who's equivalent to maybe someone 3 or 4 better than him, but he's in that top tier. Yep. So for me, that was Burrow, and I was so excited that he got to me. And then I was like, I'm putting him on IR. I'm gonna cut him. Like what am I doing?
Yeah. Well, because even if he, at that point, it's like, do you put him? Say it is week 15.
Yeah.
It's like, do you throw him back in there? Like, I don't know how sharp he's going to be at that point. But it's Joe Burrow. It's Joe Burrow over any backup. You think so?
Think
but
that he would be the better option.
In fantasy football, right? Like week 15 is like
that's a championship game.
Like I'm not putting him in then. Just let him fly.
That's a good point.
Yeah. If you need that IR spot,
someone else can use it. You can come back a little faster, right?
Yeah.
So I think also to finish up the turf toe discussion, what are our thoughts on Brock Purdy? I think it's kind of an interesting situation, right? He has a bunch of injuries on his left side, AC joint and the turf toe on the left side. But then his backup, Mac Jones, is also dealing with a nagging PCL injury. So they're both quarterbacks are banged up, and we looked it up before, and I'm pretty sure their backup, their third string quarterback's a gentleman named Adrian Gonzalez, who's a rookie. Yeah. Out of Kansas State or Fresno State or something like that. I forget, but someone no one's ever heard about.
Here comes the Tom Brady type rise.
Yeah.
Right? So I think Purdy's coming back in a week or two.
Yeah.
And I don't know if it's this week or next, but.
What's your prediction there?
I think, they as long as nothing's ruptured, they tape him up, and he's gonna end up toughing it out for the team. He's such a good story the whole time. He's gonna be back out there.
How often do they wind up injecting one of these?
So that's kind of a
questionable,
discussion and topic. But I think that they probably would. For his long-term health, it's probably not going to be best. But they probably would.
Yeah.
So we'll see what happens in the next couple of things.
As a quick aside, Mac Jones. Not that that's what we're here to talk about, but like PCL injury happened during training camp.
Right.
I guess kind of forced into it, goes back in because Purdy couldn't, and probably too soon. So here we are now dealing with another PCL and aggravation of the PCL injury. And I feel like you're playing with fire there, right? Like the PCL is a weird ligament. Like sometimes you're absolutely fine. It's not an issue. And sometimes you're not. And hopefully they can give him a little time to let that heal now.
Right.
I guess we'll see how that's going for them.
Yeah, and I
for
think
the
you're
Niners.
kind of playing with fire in a little bit. You have two quarterbacks playing with kind of like a decent risk of re-injury, right? Like, so it's like you got to really play the numbers of like who's going to be at risk of injuring it more or at like higher risk of.
It's still a good team,
right?
So you don't want to
use all your weapons.
It's early.
Yeah, but again, like you said, it differs early. So I think, I don't know. I feel like Mac Jones might get the call again if he's dealing okay, just to let Brock Purdy kind of get better for the long term of the team.
San Francisco just keeps having those long term, the Christian
injuries.
McCaffrey calf. That,
Right.
Last year
That's
was
exactly
all
right.
year long. It's
Yeah.
like San Francisco's can't catch a break.
Something in the
Little
water over
snake
there.
bitten.
I don't know.
Right.
Since Dr. Brand is here, we had to go down the little deep dive in some recent injuries. I think to briefly talk about some Achilles ruptures that recently happened, we have the Washington Commanders' Austin Ekeler and the running back from the Chargers, Najee Harris, both went down with Achilles ruptures this past last 2 weeks. So just talk about that a little bit, and I think it's interesting to break it down. I think there's a little bit of both, right? Like, I think Ekeler is on the latter half of his career for sure. He's 30 years old now. He's been constantly dealing with injuries the last 3 or 4 years as someone who's really loved him in fantasy football his last good year, and I keep thinking he's going to bounce back, and he just keeps getting banged up. Last year, 2 concussions. The year before that, a pretty significant high ankle, I believe. And now this year he goes out and tears his Achilles.
Right. And Dr. Brand is a Commanders fan, and
Yeah.
so he knows it very well.
Yeah, that hurt me. But yeah, I saw it happen too, and it's like you can see him go down and grip his calf, and you knew it. And it's just, I mean, I would say he's done. You don't come back at 31, 32 of a year off, because that's a year recovery.
Right.
Yeah.
It's a year recovery if everything's perfect, because
In
that's
best scenario.
Yeah, best scenario. So I mean, I think he's going to call it. He's had a good career. He's been awesome, and
We've had a lot of shows where we've talked about this, right? Because it's such a prevalent injury. And we've talked about, like the PARS, right? Like with the percutaneous Achilles repair system. So limited exposure, limited incisions, and anchors into the Achilles and into the calcaneus and all this other stuff. And, some kind of faster recoveries than they traditionally had been. Even with that, at 30 years old, someone who's fast cutting and like that needs that kind of. You think it's at least a year here for
but
this
honestly,
guy,
it's like
if at all.
Yeah, I think that method of repairing it can get you faster. Get you to a certain point faster. But in the end, I think it's probably the same amount of time as the old traditional just repair it and to use that PARS technique.
Yeah,
I use the PARS all the time.
Yeah.
I've done both, this and that, but. The Aaron Rodgers thing. Aaron Rodgers, it was like this brand new thing, and it's like it really wasn't that brand new thing.
No,
it
it
had been
wasn't.
out for
It was new
years,
to the public.
And it was like it was just this magical thing because he was out there walking around so much quicker. But it's like you get better quick, and then you still have to rehab everything. You still have to get the muscle back, get the strength back.
There's a plateau there.
So it's like you get faster, you get better quicker, and then you plateau. And it's in the end, I think it's the same timeline.
Right.
I don't think there's data to support that it's that much faster. It's a bit faster, but the only thing you can think is like that repair does anchor the proximal portion of the rupture to the Achilles. So it's you're almost reinforcing it a little bit better. So it's like if you're stressing the calf muscle, by stressing the calf, you're pulling up on the heel. So it's a little bit more of a reinforced repair.
Right.
But the idea anyway in any Achilles rupture is you're repairing the tendon, putting the tendon back together, and the tendon's doing the work.
It still has to heal.
So it gets you better quicker, but in the end, it's like you lose so much strength from that time, that from being in the sprint, the boot, walk, and you can walk quicker initially. But that whole time with the Aaron Rodgers thing, I was saying, I think I was on here for that.
Yeah,
it was. That's right. That's right.
And I was saying I didn't think that he was going to come back that year. I just never thought you cannot come back from an Achilles rupture. And it's like he was running around, kind of jogging around in 6-8 weeks or so.
And then the window closed, right? Like you had a window to get back, and then
and then that deadline came up, and it was like, no, I'm making it. You know,
and I think the Jets at the time were out of playoff contention, so it was an easy answer. Like there's no reason to go crazy, right? Like let it be what it is. And I think also like getting back from it's one thing, but getting back to a level of performance that you were at is kind of like similar, like we've talked about before with like ACLs and other things. Like that first year, you're back, but you're not really the same as you were.
You're not the same player.
And I really take like those 2 years is like kind of like
Unless you're Adrian Peterson.
Well, yeah, that's
Ruined it for everybody.
Right. He's the guy who's like 6 to 9 months.
Superman.
Everyone thinks can figure it out. But with that too, it's just like I don't think that Ekeler at this rate is going to be coming back at the high level.
And his position and the way that he runs.
Right.
Yeah.
And I think, last year with the concussion stuff too, and like, yeah, granted, his brain's going to be good this year, not going to get banged up too much, but like, I just don't think physically he's going to be that productive, or he's kind of like
a backup somewhere, maybe hang out just as
just third
He
down.
was kind of sliding into that role, I think, anyway, as it is, to be honest with you.
Because of Bill.
Yeah. Who hasn't been quite as good as I thought he was going to be, but he's still pretty good.
Yeah.
He's still pretty good. The and just so kind of clear, or like to try to shed a little more detail or light on the details of what you were saying in terms of that repair, right? You're putting stitches within the muscle belly side of the tear, and then you're attaching those with the anchors directly to the heel bone, so that holds the two pieces of the tendon right next to each other, so people can tend to walk a little more quickly, because those super strong stitches that we put in there, those tapes, suture tapes and whatnot, fiber tape, they're actually making up for the gap, the torn tendon. But in the end, that tendon still has to heal before, because those tapes will only take so much pressure before they give way.
Yeah, you think a lot of times the tendon's probably healed pretty good and solid in those first 2 months or so, but your calf, your gastrocs, you atrophy so much. That's what takes so long to recover.
We called it flubber the last time.
The flubber.
I remember.
Everybody comes in those first couple of weeks and they're like, "What happened?" And it's just like mush in the back. But you can't beat that. That's going to happen.
It just happens.
But there's been a lot of Achilles. I mean, in the last year, basketball, the playoffs.
Basketball, yeah. I mean, I think that's the last time we may have like thought about bringing you on, because it was like the little epidemic of all these Achilles ruptures in the playoffs, and just all these guys pushing through these calf injuries, and it's just.
And there were a lot of those prodromes, those calf injury prodromes, and next thing you know, Achilles tear, and you're like, oh.
I just think these guys are so big and so strong. I think the muscle is just overpowering those tendons.
Right.
I think that the guys, they're just so conditioned, and it's like not like it was even 20, 30 years ago. It's like look at everybody, look at the linemen.
Yeah.
There was a stat I think during the Super Bowl where it showed like the offensive line of the Eagles, 30 years ago or something, and they were like 100 pounds lighter on average.
Right.
These guys are just enormous now.
They're so much bigger.
Putting so much force through those tendons. I just don't think it can hold up. I think that's in with basketball.
Yeah.
Everybody's 6'8".
Yeah.
Mm-hmm.
Pretty much. Yeah.
I think that they're just putting
insane.
And
they're
the
so
evolution
strong.
of strength conditioning and all exercise science and all the exercise physiologist people who are just like maximizing the human capabilities. Like, Mother Nature says these tendons can only take so much load, and it's like, all right, that's it. It's snaps.
But it can just happen to anybody. I get,
right.
I see Achilles ruptures a lot, and everyone's always like, what was it? What did I do? And I always say, look, if it can happen to these pro athletes who their job is to be strong and flexible and run and be athletic, and they have trainers and nutritionists and everything.
Still,
if it happens to them, it's like, what are you going to do?
Yeah.
Like it can just, you go out and play pickleball and you tear it.
Right. Yeah, it could just happen. And like some people, they're like, oh yeah, it felt a little tight that day, or felt a little weird.
But that can predispose you to
right.
it for sure. Yeah.
Yeah, like, but it's usually never like, I never thought of it before. No big deal. Next thing you know. And I think that it's kind of an interesting situation with Najee Harris, in that we've talked about him before, right? Is that he's been kind of out since the 4th of July with this eye injury.
That's exactly where I was going.
He's been like, I kind of, when I saw it and I thought about it, and I was like, man, I wonder if his lack of activity is kind of puts him in like the category of like the stereotypical weekend warrior who you see these Achilles ruptures in.
Too much too soon.
Too much too soon, right? And like, I don't know. I think because he was 4th of July, and it's the 24th of September now, so it's figured 2.5 months or 2 months or so he was kind of out and doing very minimum.
Like preseason week number like 2 or 3, whatever it was, like they're like, we saw Najee Harris running on a track, like
running laps.
Like, I don't know if that was quite enough to get him ready for the stresses of an NFL football game. And then, like, do you think that puts him at risk? Does that possibly predispose the fact that totally different? Like, he had this eye injury at the 4th of July, maybe chemical burn. We don't even know
Yeah, we don't
exactly
even know
what it was that happened. But he wasn't able to practice, wasn't able to do anything, and then he tries to go and play.
Yeah.
It's
You're not
just too much
conditioned
too
to that
soon.
point. Yeah, you're not conditioned and ready to go as everybody else was.
Right.
I mean, I'm sure that's why, like talking about Christian McCaffrey with his calf injury last year, I'm sure that was the reason why they held him out all year, for fear of an Achilles.
Right.
You have tightness in your calf.
Yeah.
You can tear your calf muscle and whatever. That can still take months too. But I'm sure that they held him out for fear of him tearing the Achilles, and then it's a year.
Right, and it's a year. Right.
And
And then
might
also,
change
it's also the question mark: will you ever be the same? Because you might not. Right.
Right.
And I think with the Christian McCaffrey with the bilateral Achilles tendinopathy, and then coming off with the calf, and else like at that rate, and then he comes back and hurts his PCL and he falls and hurts his knee. So at that, it's just, all right, that's enough for a year. Like just we can't. He's not. That's not going to be a good ROI for that franchise. Right. He's not coming back with that. To go down our list a little bit more,
Couple guys
here. We'll start with a pretty significant looking high ankle sprain for the receiver from Dallas, CeeDee Lamb. We talked about it before the show, and we were both saying like he got twisted up pretty good. And I think as of right now, he's still not on the IR. So I think they're hoping that he's coming back within 4 weeks.
Right.
So what are your thoughts on that?
He looked pretty excellently rotated. I would have thought it would have been worse than what they're saying. But a high ankle sprain is tough because, you can have a regular ankle sprain, low ankle sprain, your ATF and your CFL, like a typical inversion sprain. And their timeline for that is probably going to be a 4 to 6 week thing. And again, these guys are getting an MRI, so you know exactly what the extent of their damage is.
Right.
But a high ankle sprain is involving the syndesmosis above it. And I'm sure he had an MRI, and I'm sure it didn't, if it showed any amount of damage in there. So there's grades for that too. Grade 1 is like you kind of sprain into, you can tear the anterior part, the intermediate part, the posterior part of that complex.
Right.
And I'm sure he must have had a grade 1 or, didn't tear anything surprising. I don't know how, but then you got to think, on a guy like that, that for the level of play that he's at, sometimes if there is any damage at all, they're much quicker to say go and repair that, put some tight ropes in there where you're basically recreating that ligament and making it as strong as what it needs to be almost off the bat.
Right.
You can recover quicker. But so the MRI must have showed that there's not much structural damage, right? Yeah. Because to me I thought that was okay. There's 2-3 months there, but.
Yeah, that is.
He got lucky. I think he got lucky.
He's saying he's going to come back in a week, which I think I have to imagine is a long shot. I don't even know if he's been ruled out definitively or not for this week, but I got to imagine that.
I think right now, reports are saying just doubtful,
right?
Which I mean, it usually leans to being out,
right?
But
like 75%.
Yeah, with those high ankles, anytime I see those in the world of fantasy football and the guy's coming back, I'm like, that's a high risk of re-injury.
Right.
But if the MRI shows no structural damage, it's kind of like you play when you're ready.
Right. Right.
If there's no risk of it, then hey, you go out there, tape. I'm sure they tape it up and go.
Tape the heck out of that thing. Yeah, for sure.
Yeah. Tightrope. A little nod to Arthrex again. Like that's one of the big things that. The internal race we talk about all the time. Tightrope we talk about all the time. These are things that have changed sports medicine.
Tua was the first for that at college. Remember, he had a high ankle.
Right.
Must have torn a portion of that syndesmotic complex, and they put a tightrope, and he came back really quick.
It's amazing.
And that was one of the first ones where it was just like, yeah, there's an injury. It's like just put some tight ropes in and go.
Yeah. Even before him, I thought that's what they. Oh no, it was screws for Terrell Owens way back when. Yeah. In my mind, it was a tightrope, but I think you're right. I think they had done screws for Terrell Owens to get him back for the Eagles so quickly.
Yeah.
But the nice thing about tightrope is there's a little more flexibility in there. Like screws are rigid, whereas the tightrope you can still cinch it together, but you have a little bit of motion within it. Yeah.
A little more natural motion to it. Yeah.
Right. And then the other one that we wanted to talk about, and I'm very curious to see how it plays out with CeeDee Lamb because my first pick in another draft, but we'll see how that one shakes out. If I had to predict, I would still guess 4 weeks for me personally. But I don't know. Maybe it'll be less than that.
Yeah, I don't think he plays this upcoming week. Next week's a toss. I mean, if they're not putting him on IR, right? They're not expecting him to miss 4 weeks, so he's going to probably come back in 3.
Yeah.
So I guess that's.
If it's high ankle, to come back quicker though is fast. I just feel like maybe I'm wrong, but
typically high ankles going to take longer than an inversion sprain.
Yeah.
So
some of those inversions you can get back pretty quick with just control that swelling so it's not super fat, and then you just tape the heck out of that thing and hope for the best. Brace it. You tape and brace, double down.
Right.
And you hope that George Pickens can pick up the slack.
Right.
Yeah, figure
Who
it out.
I did draft in a number of leagues, so I have that benefit.
Yeah.
You're right.
All right. So on to the last guy, and I think this one is kind of a fascinating one to talk about.
Right.
James Conner, right?
Yeah, so I think that it's very interesting in James Conner is that, he was on the list of like someone I wanted to talk about tonight, and then when I started doing some deep diving, some reports, everything initially said ankle injury, and then it kind of got clarified a little later, like a day or like it just happened this week. So probably like yesterday or this morning, it was like, oh no, he had surgery on his foot. Now it's like a foot injury, not an ankle injury.
Yeah.
And we started to deep dive into this before we hit the record button, so we got to restart that conversation a little bit here. And I think it's interesting because at first I'm on my sheet, it says ankle dislocation, but then as we were talking, we looked it up a little bit. Now it's like a foot injury, and then let's just kind of talk and speculate of what that could have been based off. We watched the video before we were on air,
Right.
So let's dive into it.
Yeah. So as a foot injury, as opposed to an ankle dislocation or fracture dislocation, what would be your best guess of what this could have possibly have been, the actual injury?
I would have thought off the bat that it would have been a Liz Frank injury, but typically the NFL and all the major sports they'll discuss they'll say Liz Frank.
It's
They'll say
common
the term
enough
Liz
that
Frank,
people
right.
say it. Yeah.
And you know that a Liz Frank, you hope that you have an injury to your foot, and it's like you hope it's not a Liz Frank,
Right.
because that's what's going to take a long time. That would probably be my guess on it, but they didn't say Liz Frank,
Right.
which would so then I would think if it's not that, it could have been the way he kind of externally rotated the foot on the tibia. It could have been a subtalar joint below the ankle.
What does that mean?
Which is, it's the joint below the ankle. The ankle kind of does the up and down motion. The subtalar joint is kind of the side to side motion, inversion, eversion, right below the ankle.
Yeah.
So you can dislocate that entire joint, which is when you have to reset that. It typically doesn't pop back into place. You have to reduce that back into place.
Right.
But the only thing that makes me think that it wouldn't be that is because they said that he had season-ending surgery on that.
Right.
On a subtalar joint dislocation, you can't repair those
You
ligaments.
boot it or you cast it or something once you get it lined up.
Yeah, the
right?
ligaments holding that joint together are deep inside that you can't repair them. You let that scar in, you let it heal. The only thing you really do for a subtalar joint dislocation is if it becomes arthritic down the road, you fuse it, but they're not going to fuse him off the bat.
No.
Maybe he tore some ligaments along with a subtalar dislocation.
Right.
Another possibility.
Could have it been open? Maybe that's why he needed surgery. I just thought of that right now. If it was like an open subtalar and they had to wash it out.
That's possible. Because they did cover it. They covered it with a
they
towel
kind
or
of
something.
from the report I said there, he was kind of carted off with a splint and covered in a towel.
Oh.
And usually when they cover it with a towel, something's going on that you don't want to see.
But a lot of times with the Liz Frank, it's like you can have a dislocation without a rupture on a Liz Frank, which can sometimes be worse. But that could have been it just separated that Liz Frank ligament complex, and it wasn't only. It wasn't dislocated completely enough, and they can just put it like another Arthrex product is the internal brace for the Liz Frank ligament complex.
Right.
It's like an anchor to an anchor, and you just cinch that complex back in place.
Right.
But if it were that, then I don't know why they would have covered it with a towel.
Yeah.
That means I feel like something was popped out of place, and it was gruesome.
Pretty gruesome.
looking.
Yeah. They cover it.
Yeah, they kept saying it was kind of gruesome, significant, like some kind of decent foot ankle or foot injury.
So a couple questions then about these particular. At first, I know it's a really hard thing to sort of describe, especially without like an anatomy or a model in front of you, but kind of grossly the best that you can. What would be the difference generally between something called subtalar dislocation or versus Liz Frank fracture or Liz Frank dislocation?
Well, the Liz Frank is right in the midfoot, so it's where your metatarsals meet the tarsal bones. So it's a rough injury because that's another one like an Achilles. It's like a year out. So what I deal with is like the longest recoveries are Liz Franks and Achilles ruptures.
Right. Yeah.
So the Liz Frank is when one or more of the metatarsals shift. It's almost always they shift laterally.
Yeah.
Mm-hmm.
So if it were a purely ligamentous Liz Frank injury where the metatarsals all shifted laterally, then they wouldn't say it's a fracture. So that's where I was kind of thinking maybe
fits,
that.
right.
But you would still need to fix that. And you can try to, put it back in place, hold it back in place. You can put plates on top, take them out later. You can put the internal brace in. There's a lot of different methods. You could talk all day about how you can fix that and different ways to fix it and what's right and what's wrong.
Yeah.
But that's what I would probably bank on. But it's like if it were bad enough that they had to cover that with a towel, then that would probably be, I would bet, career ending if it dislocated his whole 4 foot over.
So if you had a Liz Frank that was so bad they needed to cover
Then you
worry
worry
that's a career
then it's
ending.
all the metatarsals, like
Yeah.
homolateral dislocation, where it shifts everything over.
Right.
And I've seen that, and sometimes that in that case, the go-to for that is like you primarily fuse some of those metatarsals. It's
Right
like,
off the bat.
I don't know how you come back from that in a reasonable time frame, but then then it's like, could it be the subtalar where it's just dislocating below the ankle? So it looks like an ankle dislocation, but it's more down into the foot.
Closer to the ankle than the Liz Frank.
Back more. It's right under the ankle joint,
Right.
but it would look like your whole foot is dislocated,
Yeah.
Right.
probably laterally, based off that video of him.
Can you have those dislocations wind up being open injuries?
Oh yeah, it could be. So sometimes like the head of the talus can pop out through the skin.
right through,
You know,
right.
and like
Yeah.
that could have been. And maybe they went in, they flushed it out.
Yeah.
Sometimes you can put a little internal brace or an anchor to kind of hold the tailor-navicular joint in place.
Yeah.
The tailor-navicular joint it would be the subtalar joints here that kind of go side to side. The tailor-navicular joint's right in front of it, where it's meeting the bottom portion of the ankle to the midfoot, to the tarsal bones.
Right.
And that joint, a lot of times with a subtalar dislocation, you will also dislocate the tailor-navicular joint,
Yeah.
which is pretty unstable. So maybe they stabilized that joint,
Yeah.
and left the subtalar joint to scar in and heal.
Yeah.
But I mean, I've had athletes that have dislocated their subtalar joint, but did not dislocate the tailor-navicular joint. You let it heal. It takes a long time, but they've got back to full function.
Yeah.
Yeah.
It just takes a while to let everything scar, and you're a little bit stiff. The range
Yeah.
of motion isn't quite all there, but you can get back
Generally do well.
without surgery for that. But
Yeah.
he had seasoning, so something was repaired.
Something happened. Yeah.
Maybe it
something-
was open and they just closed him up,
Yeah.
let him heal. I don't know.
If it was Taylor, we're making we don't have access to his medical charts. We're just sort of
Right.
making guesses and presumptions. But let's say someone has a subtalar dislocation and it's not an open injury. Is that something that you can frequently have reduced in the ER, or are they going to the operating room to get that lined back up to get it reduced?
you can reduce that in the ER.
Yeah.
And
yeah.
I don't
And
think
then what's the treatment for that one if it reduces easily in the ER?
if it reduces, you put it in place. You would always get a CT scan, make sure nothing else was fractured. There's
Yeah.
no hidden little fracture lines in there,
Sure.
for especially the talus.
Yeah.
But if you can, they're not going to reduce him on the field. So if it was that, it would make perfect sense. They cover it up. They take him in the locker room, probably numb him up, reduce him,
Yeah.
pop it back in place, and then it's just you have to stay non-weight bearing for weeks.
Yeah.
It's
So they put
weeks.
you in a boot or put you in a cast or something
Yeah.
or other. You're not getting surgery for that though.
But you wouldn't get surgery for an isolated subtalar
Right.
fusion.
Right. Right.
Yeah, so I think it's the devil's in the details with this one, and I
Yeah.
think it'll surface eventually. And I think the
Probably.
speculation of what we're doing tonight is
That's why it's fun.
yeah, it's fun because even just now I was like, I don't know if there's any new reports out, so I'm just scrolling Twitter and just trying to
Looking
see
to
if
see-
anything, and
yeah.
not much. And I mean, the one report that it kind of keeps coming up, obviously it's old, but it's from Adam Schefter, and they just put in quotes, it's a severe foot and ankle injury. They don't know the extent of the damage yet, so it's like, yeah, it could be something way out there that's like kind of what we went
We don't
through.
even- yeah.
you don't even know, and then who knows, and then he's another 30-year-old running back, so it's like
Could be the end.
could it be the tail end here, and with him and Austin Ekeler, these guys when they hit that 30-year-old mark, it's like not young in real life, but in the world of NFL, that's
For running
for
NFL running backs
running
in
backs
particular.
especially,
yeah,
right.
yeah, for sure, right? Like you're not making it over that hump and trying to be super productive still at that rate.
My guess, as we talk through it, is maybe the open subtalar dislocation, and I almost sort of hope it is, assuming they are able to wash it out and assuming he doesn't have to deal with infection. I feel like that gives him the best chance at actually coming back.
Right.
down
Be
the line.
better than a Liz Frank dislocation.
yeah.
Better than one that they would have to cover up because of the look of it.
Right.
If that were the case, then that's probably the end.
For sure. Yeah.
So I think those are something that we kind of keep our eyes on. as
You can
we go
drop him
forward.
too this season. I
Yeah,
take it.
definitely. You let
Yeah,
him go
yeah.
off.
Especially if you have a Marion Hampton.
Yeah.
Yeah.
Yeah, don't hold on to him much longer. Try to find what's his name? Trey Benson, I think, is the backup there in Arizona.
Oh no. Yeah, you're right. I'm sorry.
Yeah.
I'm still thinking Najee, but you're
No,
right.
but even still,
for Arizona, it's
Marion
Trey
Hampton,
Benson.
Trey Benson, Bill from the Commanders, all good.
Bill.
Bill.
Yeah.
Bill.
Bill.
I think he's going to have a decent year, though. I think he's going to figure it out. Bill is going to
So do I.
do pretty well.
And I guess, is it Rodriguez? You tell me, who's the other?
Chris
the other one?
Rodriguez.
That's the thing. They've got a couple guys that they like.
And, McNichols, right?
McNichols. They liked him well enough to let Brian Robinson go.
Good point.
Right.
Brian
Which is crazy to
Robinson-
think now. It's like, ooh, was that the best decision? After
Unless
Ekeler goes down?
unless something happened there, like a personal thing. But I was surprised to see him go because I thought he was. I really liked Brian Robinson.
Right.
But they really were really high on Bill.
Right.
Yeah.
Bill.
They were really high on Bill, and he looked really good in the preseason. He looked great. But that McNichols has done great too. They've got a lot of younger guys. And
Yeah.
And it's crazy because even McNichols, he had like a 60-yard touchdown last week, and it's just like,
yeah.
hey, if you can get that kind of pop production
And
from
he
your
was
guys,
moving. He was
yeah.
moving. But, then they also brought in Debo Samuel, does a lot of little gadget plays, running plays. He does a lot of end arounds.
Right.
So it's like maybe they just something with a
kind of by committee.
maybe they were trying to pay Terry.
Yeah.
Right.
Maybe
They're
trying
also-
to
pay
get that
Terry.
money to pay Terry. I don't
That's
know.
right.
Also, to dive into Terry a bit real quick, is that
Quad?
he's quad, but he's also taking a trip to Philly to see Dr. Myers, who's a core injury specialist, which is kind of interesting and
The
kind
plot
of
thickens.
I saw the update today. I was like, that's kind of odd for a quote unquote
Oh,
quad
no.
injury.
No, I didn't
To
see that.
Yeah, I just got they seen Dr. Myers in Philly to see, and he's the guy who fixes all the core muscle injuries, so that's not a good thing.
Athletic pubalgia.
Don't want to see that, so it's like, I don't know.
So if it is, at least that's one of those things where oftentimes we're getting through the end of the season. Not every time, but oftentimes.
Right.
And then fix it in the off season.
Yeah.
But then there you go again with his whole hold out, wait for the
Right.
contract. And
Right.
then third game in, he's out.
Yeah,
Right.
that's I
It's
think
like
I
you're
said
not
that
up to par.
Happens all the time.
I think
Right.
I said that in our pre-NFL the draft shows. Like these guys who hold out and do all this stuff, I just don't like their outlook for the year because they're just not conditioned. They're not up to speed with everybody, and they kind of fall in that. They're pro athletes, but they fall in that weekend warrior thing of like they're not doing so much, and they try to uptick the production, and that's when injuries happen. It's not good.
They don't have a ramp up.
Right, and it's just a quicker ramp up, especially with shorter preseason now, and then so you don't take those. Now it's not 4 games, it's 3 games, and starters barely play.
Right.
And then now you're going just 0 to 100 after holding out for your contract, and more things start to happen. It's not good. So before we go ahead and end the night, anything else?
I'm just glad to have you back, man. It's been
I
a
know.
while.
I'm
Thank
glad to
you
be
for coming
back.
on.
I love coming back in here and doing this. I have a good time.
Yeah.
I want to ask you guys if you guys talked about, you guys do a lot of sports injuries talk and whatnot, but what are you guys' thoughts on the tush push, the false starting tush push?
Right.
It is a false start.
Right.
Yeah.
Yeah.
What are your thoughts?
Said the commander's hand. Yes.
Yeah.
Yeah, right. I'm biased.
For sure.
You guys tried to jump over it like 6 times. That was the craziest sequence of
Frank
touch.
Luvu
Just kept going for it.
There was nothing else. It was pure desperation.
I mean, as an Eagles fan, I'm definitely biased because it works, right? But I get it from the standpoint of the false starting and everything else. And
Yeah.
I think teams are also just trying to get like just the offside penalty, just tap it over. And I think they even did it this past week or the week before, and they ended up declining it. Instead of giving them a 1st and 10, they kept a 2nd and short or whatever the case was, just to get the first down and get more plays out of it. I think it's just going to be officiated a little harder, and you're going to see probably a couple. I think incoming false starts are going to come.
Yeah.
I
Down.
think they have to make it right. Yeah, it's like they have to start calling a couple because it's tough to see in real time.
Yeah.
In slow motion, they're going early.
They need to rely on the replay booth.
And that's why I think that's why they're so good at it. It's like they know that it's like, okay, as soon as these guys go, you snap.
Right. You have
it's
the
like,
advantage.
Maybe that's what their other teams
The
need to
secret
figure out.
sauce, why
Because
other
Washington
teams
was
can't
doing
do
it too. Like Washington fans, like they were doing it. They were having Zach Ertz run in. He would take the snap and he would go, and they would kind of do that. But so I wasn't like on the whole fence of get rid of it completely because Washington was kind of doing it. They were doing okay with it. They they had a good year last year, surprising. But I think that they are going to end up getting some false starts just to kind of be like, okay, we're watching it type of thing. Because so many teams were against it.
Yeah.
Yeah.
And it is. I think it's unfair to make the play illegal simply because one team is better at it than everybody else. It is an incredible advantage over the rest of the NFL, but it's partly their personnel, right? Saquon and
Jalen Hurts.
and Jalen, right?
I mean, you got 2 guys who's
Yeah.
squatting over 600, 500 pounds.
It's a huge asset and huge advantage. Like it's almost every single time, right? Like, and if it's third down and it's like a yard, 100%. You have 2 tries to do it. They're getting
Right.
it
Yeah,
100%
you're
of the
gonna
time.
get
You're not going
Right.
to see Kyler Murray in there
Right.
forcing the offensive
Pushing
line
that down.
forward. Right.
Yeah.
Right. So it's unfair to take it away from them just because they're good at it. However, if the advantage is a byproduct of a false start, well, they need to start calling that a little more sharply.
And I think this weekend is going to be the tell of what other teams are going to do in the future. Is that we're playing the Tampa Bay Buccaneers this week, and they have that gigantic lineman who has been crowned the tush-push stopper because he's 500 some pounds in the middle.
Right.
So I think he's going to
We'll
be
see
playing
how that
this.
goes.
We'll see how it goes, right? Like it's going to be a lot of mass to be
Why
moving.
don't they just push the center? Like they don't have centers anymore. Or the whoever the interior lineman is lining up right over the center. Just push
Push him.
that guy.
Yeah,
back
defensively
into the
tush-push.
defensive.
Because they get there first. They do it first.
I
It's
see.
like because you
They
have
get
to
there
wait for
first.
them to snap first. So
Yeah.
it's like that. It's like momentum. Whoever
Yeah.
hits first is going to
That-
have more momentum.
Half
to
a
go.
second or
And
millisecond.
it's just
Yeah.
so even like I think the one thing I would say that it does affect like the whole play itself, offense and defense, everyone's in the neutral zone.
Right.
There's no neutral zone in that play.
Right.
Like everyone crowds in and there's helmets over
It's
the
illegal.
ball.
Yeah,
It's
yeah.
the whole
Well, they'll call that sometimes.
the whole setup is
Lined
a
up
bit
in
off.
neutral,
And
yeah.
it's always happens so quick, right? It's
Yeah.
always a quick lineup and go.
Right.
And that's
Yeah.
the whole point, to get that half a millisecond advantage that you really can only tell on a slow-mo. And
Yeah,
then it's
only
like,
slow mo you can see him go.
and that's
yeah.
what I think the rule analysts that have been on TV have been saying. Well, like, yes, we see this on slow motion, but play it real time. How hard is that to
You
tell
can't really tell.
from these guys who are standing 20 yards away from it on the sideline to tell
Yeah.
that that's happening?
Yeah.
It's a tough
But
play to call.
now there's it's, you don't have to challenge it. There's just replay assistance, whatever it is, or
Yeah.
replay. And like the guys who are watching the replay should be able to call him like, oh no,
Yeah.
we slowed it down.
Yeah.
That play
I
didn't
think
count.
that's
Sort of
going to
play.
just eventually kind of is going to be what it is going to be, some kind of new rule caveat that where they can challenge
Right.
it or there's going to be extra scrutiny on it.
Yeah.
And then they just kind of take care of it that way.
Yeah, it's tough to. Oh, it's like it's like another thing. I was talking to people about recently is like they were looking at all these like blown calls in baseball, like the umps behind the plate. It's like, but you're looking at the TV where the square is, and
Yeah.
you see perfectly where that ball goes in the strike zone.
They don't.
Whether it's a striker, and it's like, but that ump has the final say.
Yeah.
Yeah.
So at what point are we just going on and we're watching these guys play and technology's doing it all, or is
Right.
are we relying on the human error part of the refs?
It is
and
nice to
umps?
have a little bit of human error.
So
I will say with the umps though, it becomes like a pride point too many times where like they don't like that you're a reaction, so they're gonna hose
Yeah.
you
Yeah.
and they're gonna like really like they're gonna call a strike or something that's grossly outside the strike zone.
but
just
millions
to,
of yeah, right,
And, like,
but
that
millions of
part
people are
is
seeing
ridiculous.
exactly where it is.
Right,
And it's
right.
Like, was it so
yeah.
that's
And
tough.
but in MLB they don't work for the MLB, they work for their own. Like that's a
Right.
whole big thing. They don't answer to the MLB. They answer to the Umpires Association, whatever
Right.
it is that they're answering to, and it's good because then it takes away a little bit of the pressure, right? Like they're independent, but it's also bad in that scenario where they start doing something. Some of these guys will start making bad calls purposefully to show a guy up, and like you're not the star of the show. We're not there to see you
Right.
make a call in the show. So we want to see good calls so the stars can shine. Like that's when it really starts to piss you off.
So then in that realm where you're you can look back on that and like I know what is it in college you can challenge those
Right.
right
Oh,
So
really?
that- I'm pretty sure you can challenge balls and strikes in college and you
Right.
can't really challenge that in major leagues but
Yeah.
so then what if it were okay other teams that they do the tush push, why can't another team throw their flag challenge flag and say, okay, look at the replay. Was that a false start? Actually, you actually lost 5 yards.
Yeah.
Right.
So maybe other teams start to say, look, they do the tush push, they score, throw the flag, take a chance.
Yeah. It
'Cause
should
the
be
majority of
reviewed
the time
anyway
they
if they
are
score.
going.
Well, if they score, that's
It
the
should be
tricky
reviewed
part,
anyway.
right? It's
Automatic review.
Yeah.
It's true. So, but
Yeah.
they, and
But
then,
then,
they-
but
they
it
still-
hasn't happened yet, and I think that's the truth. Like that's the weird part.
At
Of
some
like,
point, someone's going to throw a flag on that and say,
Yeah.
check it out.
Check it. Yeah. And they'll get it right. Yeah.
Or it's like on all those 4th and 1s.
Yeah.
It's like you could throw a challenge flag. It's like technically it is a false start. So
Yeah.
yeah,
Back 'em up.
that's on that fence of like, okay, look at it
Yeah.
in real time, you don't see it, but
When they
that's
catch
what a
it, slow
challenge
down.
is. That's
Yeah.
what a challenge is.
yeah. I think this year it's going to be continually a discussion. It's going to keep getting brought up,
Yeah.
especially if the Eagles continue to succeed at it, which they've done.
If they go the whole way and they
Yeah.
do it again,
Yeah.
people are gonna be pissed. And yeah.
Yeah, and I mean, I really, at least in last week's game against the Rams, I don't think that was the deciding factor.
No,
and you know
it
what I
wasn't.
mean. And I think in group chats I'm in with my friends, and I was like, oh yeah, good thing we had the tush push to make a gigantic comeback and block a field goal and win the game. Yeah, because the tush push won us that game. Yeah, absolutely
Right.
not. You know, like a little bit of difference.
It is still such an advantage.
Oh yeah.
Well earned, but
But you look at all the teams that have tried it and failed. It's like it's not the unstoppable. It's not perfect for everybody.
Right,
Right.
exactly. It's
There's
just
some
they do it well.
strategic advantage that the Eagles figured it out, and it works for them.
It'd be like saying, "Hey, man, that Christian McCaffrey guy, he's too fast and too shifty. We got to make that illegal." Like,
Yeah.
no, like that's
You can't
the
run
advantage.
outside
Right.
zone with him. He's too fast. Like, no, I don't know how that works. Been a great time.
Yeah.
Hopefully,
for
it's
having
not
me
back on.
hopefully it's not over a year the next time you come back.
Heck no, man.
Hopefully
I always
we'll
have a good time.
Have a crazy foot and ankle related thing that we can talk to you about. So before we go ahead and close out our tap for the evening, we're just going to give a quick shout out to some of our sponsors: Virtual Orthopedics and Spine, Runners Knee, and Dog Walkers Hip. They have a doc for that. Yardward Back and Laptop Wrist. They have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. Neck of the Woods Brewing Company giving us the best beer in South Jersey while we record our shows. And then lastly, Timber Real Productions helping us get all this media out to you awesome listeners. So folks, have a great time, and we will see you next time.